Hello, bonjour, kwe, ulakut, tanchi. Thank you for being a part of the Roundtable discussion for an Ottawa Peer Parenting Support Program. Merci de participer à la table ronde sur le programme de soutien entre parents d'Ottawa. My name is, je m'appelle Danielle Vernoy. I am a nursing project officer with Ottawa Public Health, and I will be leading today's meeting. As we begin our discussions today, we open our meeting by honoring the Algonquin people on whose traditional unceded territory the City of Ottawa is located. We would like to extend this respect to all First Nations, Inuit, and Métis peoples, their ancestors, their elders, and their valuable past and present contributions to this land. Nous aimerions commencer par rendre hommage au peuple algonquin sur les terres non cédées sur lesquelles la ville d'Ottawa est établie. Nous aimerions également étendre cet hommage à tous les peuples des Premières Nations ainsi qu'aux peuples inuits et métis, à leurs ancêtres et à leurs aînés, de même que souligner leurs précieuses contributions passées et présentes à cette région. This morning, you will hear opening remarks from the Chair of the Board of Health, Councillor Keith Egley, and Ottawa's Chief Medical Officer of Health, Dr. Vera Etches, followed by the plan for the morning and a design concept presentation for the Peer Parenting Support Program. Ce matin, vous entendrez les remarques du président du Conseil de santé, le conseiller Keith Egley, et celles du médecin hygiéniste en chef d'Ottawa, la Dr. Vera Etches, suivies d'un plan de la matinée et d'une présentation pour le programme de soutien entre parents. During the presentation, I will be using an application called Mentimeter, of which you may also participate even though you are not in the room with us. Once I begin the PowerPoint presentation, I invite you to use an online device, either a phone, tablet, or computer will work, and visit menti.com to provide your feedback real-time. Pendant la présentation, je vais utiliser une application nommée Mentimeter, à laquelle vous pouvez également accéder, même si vous n'êtes pas dans la salle avec nous. Une fois que je commence la présentation PowerPoint, je vous invite à utiliser un appareil en ligne, que ce soit un téléphone, une tablette ou un ordinateur, et visiter menti.com pour fournir vos commentaires en temps réel. Following this presentation will be the Roundtable discussion, which will not be streamed online. However, your input is still wanted and valuable, even though you are not in the room. Therefore, I have created a survey with all of the questions. Please visit www.opinions.ottawapublichealth.ca/roundtable to provide your feedback right after this morning's video presentation. I will also include the SWOT activity questions and the evaluation shared this morning with in-person participants for your responses. Après la présentation PowerPoint, les tables rondes ne seront pas diffusées en ligne. Cependant, vos contributions sont toujours souhaitées et précieuses, même si vous n'êtes pas dans la salle. Par conséquent, j'ai créé un sondage avec toutes les questions. Veuillez visiter www.opinion.ottawapublichealth.ca/table ronde pour donner votre avis suite à la diffusion en ligne de ce matin. J'inclurai également les questions relatives à l'activité SWOT, qui est une méthode d'analyse, et l'évaluation partagée ce matin avec les participants en personne pour vos commentaires. Please also note that while there is a parking lot for questions or comments, un endroit pour mettre au frigo les questions ou commentaires, during the meeting, you can also send your questions and comments to me directly at danielle.vernoy@ottawa.ca. Should you also be interested in further engagement on this project, please email me your expression of interest directly at danielle.vernoy@ottawa.ca. Si vous êtes également intéressé à contribuer votre engagement dans ce projet, veuillez m'envoyer votre expression d'intérêt directement à danielle.vernoy@ottawa.ca. invite First Nations Elder Irene Compton to lead our meeting in a song.
Yes, Marie. Whatever you were saying there really stirred me. So we're going to sing a beautiful song. I think if everybody can get closer up here, like maybe let's form a circle so that we can become family.
I'm going to teach you the chorus first, and then we'll go into 4 ballads.
Miigwech, Marcy, thank you, merci to both our elders for helping us start this meeting in a good way. At this time, I would like to invite Janet, the Chair of the Board of Health, Councillor Keith Edline, to say a few words.
Thank you very much, and thanks for having me out this morning. It's an honor for me to join this roundtable discussion, and I welcome you all in my capacity as the board chair. I want to thank our elders, Irene and Mary Louise, for starting us off in a very thoughtful and inspirational way. I think this is a good example of the kind of event and kind of initiative that public health brings on a regular basis. Last time I was in this room was when we were having the roundtable discussions and symposium on mental health and opioid addiction. And it was a similar model, and we pulled together stakeholders, and we pulled together regular Ottawa residents to get their feedback, most importantly get their lived experience to form the backbone of our programs we're using again today. And I think it's a very collaborative and creative model, because we're reaching out, we're finding out what people who are most impacted by what we're trying to do and what we're trying to address, what they have to say about things. So we're hoping that OPH is going to create a peer parenting support program that meets the needs of our diverse city and new families. Everyone has their own journey. You ask anyone about their family, they're all going to have a different story. They're going to have a different story about how their family's made up, whether it's a traditional mom-dad family, a single-parent family, a same-sex parent family. There's all sorts of variations, and all are valid and have a story to tell. And we need to hear those stories in order to make our program as accommodating and welcoming to all families. Because at the end of the day, you know, we may look a little different, we may sound a little different, but we're all families, and we all have the same concerns and needs going forward, and that's to make our families as healthy and well as they can be. And public health, I think, has a real role to play on that. So we're asking you today for your feedback. We're asking you for your participation so that we can go forward and create a successful program as we possibly can. So in summing up, OPH believes in and has been working to create interactive spaces for dialogue to hear directly from residents. We know that programs are always better when those affected or served by them have a role in making it happen. So that's your role today, telling us what you want to see us have at the end of the day, what our program is going to look like, what services we're going to be able to offer. So I want to thank everybody who's here today for their participation and their good ideas. Thank you.
Thank you so much. Merci, Councillor Egley. Now I would like to invite Dr. Vera Etches, our Medical Officer of Health, to say a few words.
There's not much more to say. The important things are thank you to each of you, to the staff that are here from Ottawa Public Health. You know, we have a team called Healthy Growth and Development, and every day they're trying to, support children and parents and families and people who parent. And I want to thank you for taking the time to pause and make sure that what we're doing is relevant, that we can have the most impact possible with the resources that we have. And for everyone else, this is really some of the most important work in the city, right? We know that if you can support children to live well and have what they need as they grow, that makes a difference for the rest of their lives. And I know parenting is one of the hardest jobs and one of the least recognized roles also. And so we wanted to do all we can to make sure that parents have the supports they need. We know from the data that we've looked at about the health of our population that actually a lot of parents and people who are parenting feel isolated. They've told us that, we see that. I liked your comment, Irene, about it's hard to leave the circle. And what we're looking for is a community where no one's outside of a circle, that people have the circles of support they need. And that can look different for different people. There's no one size fits all, but we do want to make sure we have those networks. And so thank you again for the work today.
Merci, Dr. Etches. Next, I'd like to share the plan for this morning. Voici l'horaire pour la matinée. I will be presenting shortly a design concept for the peer parenting support program and use an online application called Mentimeter to ask your thoughts and feedback. Durant ma présentation, nous allons utiliser l'application Mentimeter au www.menti.com pour connaître votre opinion sur le projet proposé. The website is menti.com. Once you are there, you will be prompted for a code that I will be sharing during the PowerPoint presentation. If you require a device, please see Robin, who's in the middle with her hand waving over there. We have some tablets if anyone needs an online device. Following this presentation, we will have a short refreshment break. Nous aurons une pause à la suite de la présentation, suivie par les discussions de table ronde. After the break, we will have the roundtable discussions. There will be 4 tables. Une table sera complètement dédiée aux personnes qui désirent participer en français. Each table will have an Ottawa Public Health facilitator and one of 3 themes assigned to it. After 20 minutes, all the participants will be invited to change tables, except the French table, to contribute to all 3 themes. Seuls les participants à la table francophone resteront en place pour les 3 thèmes. Upon arrival, you should have also received a package of information. À votre arrivée, vous devriez également avoir reçu une trousse d'informations. Inside, you will find a copy of the agenda, l'ordre du jour, a summary of the findings from our Engage Ottawa online consultation, un résumé de notre consultation en ligne Participons Ottawa. Some of the participants here, as well as some of those that are viewing online today, contributed to these findings and helped shape our design concept today. There should also be a SWOT, which is a strengths, weaknesses, opportunities, and threats activity sheet, as well as an evaluation sheet that we kindly ask you to complete and submit before leaving. Une feuille d'activité SWOT, qui est une méthode d'analyse, et un formulaire d'évaluation que nous vous demandons de bien vouloir compléter et soumettre avant partir. And you may leave them by the yellow comment box in the back at the bar at the back of the room. Inside your packages, you also received my contact information for any questions or further conversation following today's meeting. Vous avez également reçu mes coordonnées pour toute question ou pour discuter davantage du projet à la suite de la réunion aujourd'hui. We also have an expression of interest box where we invite you to leave your contact information. It's the blue box at the back, should you be interested in further engagement on this project. Nous avons également une boîte dans laquelle nous vous invitons à laisser vos coordonnées si vous souhaitez exprimer un intérêt d'engagement dans ce projet. Finally, we also have a parking lot. Sorry, not a parking lot, because we're going to be active transportation and healthy. So we have a bike rack at the back, our bloc nut for any questions, comments throughout this meeting today. Now that I've outlined the morning, I'd like to share with you something very special. So far, I've received a lot of positive interest and feedback for even just the idea of having a peer parenting support program. And I'd like to thank the next 3 speakers for their courage and meaningful words. Please keep their messages in mind throughout the morning. Je tiens à remercier les 3 prochains invités pour leur présentation et leur courage, et je vous demanderai de garder leur message à l'esprit tout le long de l'avant-midi. Okay, here we go. Nope, not good. Hang on, sorry, we're missing the sound. Thank you. Merci à tous d'avoir participé aujourd'hui. On behalf of Ottawa Public Health, we really appreciate your ideas, feedback, participation, and time today.
Parents need each other to lean on when it gets hard, even when it's easy, just to have those peers around you going through similar experiences. So as a new parent, I had lots of questions. I feel like I had so many questions that Google couldn't answer. So I think it's having those moms around me and knowing that I had that support from those moms. They were able to help guide me to answer the questions or to recommend where I could go to get my questions answered. I'm a lost mom, so I have 3 children, all girls, all under 7, and my third was stillborn in 2017. Going through that experience of losing my daughter, which is something that I never thought I'd be able to go through. I think any parent would say that the thought of losing a child is unbearable. And being now sitting here 2 years later, the support that I received from that loss has maneuvered me to this point where I know that that's something that I want to do. I know that I want to now support people that are going through that similar experience or that similar loss, because it was the hardest time of my life. And still navigating through that even 2 years later, it's still painful, it's still hard, but to know that I have the support, especially on the bad days, is key to my journey through life now as a lost mom.
Le soutien parental aurait pu m'aider à répondre des questions dans mon contexte. Alors, je suis une femme francophone en milieu rural à Ottawa. Et il y a des enjeux qui sont propres à moi, dont les réponses, je ne peux les trouver dans des sources primaires, comme le site de la Ville d'Ottawa, où il y a beaucoup de bonnes informations, mais pas nécessairement pour des mamans francophones en milieu rural. Par rapport, par exemple, à la proximité des services, ou des services qui sont plutôt anglophones, mais près de moi, mais en anglais, ou d'autres ressources, d'autres informations par rapport à des groupes ou d'autres appuis en français et dans mon coin de la ville, dans l'ouest d'Ottawa. Ça leur a été très utile. Le soutien entre les pairs, pour moi, signifie une oreille ouverte, une oreille sans jugement. Et c'est l'occasion de pouvoir faire appel à quelqu'un de peut-être ma génération, quelqu'un qui partage mes valeurs et mon contexte culturel aussi, et qui pourrait juste me recevoir dans l'état où je suis et peut-être me donner des conseils au besoin, parce que des fois, on a juste besoin de vider son sac. Le soutien parental peut aider les autres, surtout, je pense, au niveau de la confiance et de rassurer le nouveau parent que ce qu'il fait ou ce qu'il entreprend de faire, c'est correct. Et les décisions qu'il prend pour sa propre famille, c'est ce qui est le plus important. Et de ne pas toujours écouter les millions de conseils, les sites web, les choses qu'on entend, de vraiment se recentrer sur ce qui est important pour la famille.
I am interested in joining this project because as a person with a disability, I've gone through situations that may be helpful to parents who also have children who are going through life with a child who has a disability. When you've got a kid with a disability, it's not necessarily something that every parent that you can talk to in your neighborhood will quite understand or quite get the exact nature of. My parents didn't have anybody to speak to about what to expect for their child with a disability. With peer support, with someone to talk to that they could consult with and clear up their worries, their fears, and help them know what to expect.
All right, so thank you so much. Merci, Erin, Françoise, and Matthew for those very touching and moving words. I think it sets us up for a really good conversation today on how to build a peer parenting support program that meets diverse and different needs across our city. So the next thing we're going to move into is the PowerPoint presentation. And like I mentioned earlier this morning, this is going to be interactive. So this is where you get to take out your devices and provide input real time. So s'il vous plaît, sortez vos appareils pour pouvoir contribuer à la conversation pendant la présentation. So for the last year, I have been working on developing a peer parenting support program. Durant la dernière année, je travaille sur ce projet, and I've been consulting with different people along the way to try to figure out what would best work for our residents, for families in Ottawa. And so what I'd like to present to you today is a little bit of an idea that we've put together based on that feedback. This presentation, like this morning, is very interactive. Your feedback will help further inform this program as we develop it. And while I might not have the time to address every single question or comment that is put up, I'm definitely taking them all into account, and they will be used for the development of this program. And I also encourage you to connect with me directly to continue today's dialogue. Contribueront à façonner le programme. Bien sûr que je n'ai peut-être pas le temps de répondre immédiatement à toutes les questions ou tous les commentaires. Je vous assure que nous tiendrons compte et qu'ils seront utiles. Je vous encourage également à communiquer directement avec moi pour poursuivre le dialogue. So where we started, in 2005, we started a program called Ottawa Breastfeeding Buddies, which was a program for breastfeeding support between moms. So Amis Allaitement Ottawa, c'est un programme qu'on a commencé en 2005 entre mamans pour pouvoir offrir du soutien pour l'allaitement. Where we'd like to go and expand this program is, well, with the birth of a child comes an overwhelming amount of information and sudden changes. Peer-to-peer intervention programs can help to augment health literacy, act as a protective factor, and may increase positive health outcomes for all parents and children. Given that Ottawa is multicultural and diverse, we want the peer-to-peer program to consider and include fathers, the LGBTQ community, multicultural community, Indigenous community, newcomers to Canada, and so forth. This will also help to gain diverse experiences and create a culture of inclusion for both the mentors and the participants of the program. Nous voulons élargir l'objectif de ce programme, Amis Allaitement Ottawa, parce que la naissance d'un bébé s'accompagne d'une surcharge d'informations et de nombreux changements. Les programmes d'intervention entre parents peuvent contribuer à développer la littératie en matière de santé, servir de facteur protecteur et accroître les résultats positifs pour la santé des parents et leurs enfants. Étant donné qu'Ottawa est une communauté multiculturelle et diversifiée, nous voulons que le programme entre parents soit inclusif et tienne compte des pairs, la communauté LGBTQ, la communauté multiculturelle, des communautés autochtones, des nouveaux arrivants, etc. Cela permettra également d'acquérir des expériences diverses et de créer une culture d'inclusion pour les aidants et les participants. So, now we're going to test the Mentimeter. So when you get to menti.com, you're going to use the code 993824. And once there, this is kind of our test question, is what organizations or roles are represented here today? So you don't need to put your names, just what organization, or if you were an interested parent or an interested individual in this project, to add it to our slide. So we have Ottawa Public Health, Veuillez indiquer le nom de votre organisation ou nous laisser savoir si vous êtes ici en tant que parent ou bénévole intéressé. The Ottawa Public Library, First Words, TI, Roger Nielsen House, oh, they're coming in fast, Uville, Centertown, and they're moving around on me. Pleo is here, fantastic, thank you. Ottawa Birth and Wellness, Pinecrest Queensway. There should be some too coming in online. I'm hoping the technology online because they're able to contribute as well. OCISO. I don't know if I've missed any because they keep moving. GEO, Little Milk Miracles, home daycares. Wow. Thank you to everyone for joining our conversation aujourd'hui, today. Merci. So in order to create a new program, Ottawa Public Health wanted to talk to parents, to partners directly, and we used an online tool called Engage Ottawa, Participant Ottawa, to get information directly from parents and caregivers, as well as those expecting or even just thinking of having or even adopting a child. Some of the questions that were asked were if peer parenting support is helpful, l'utilité du soutien entre parents, what skills and types of support would be useful, les compétences et les types qui seraient utiles, which topics are important to people caring for children, mentor training or la formation pour les aidants, how to best match peers with peers, ways to talk to a peer, and feedback on possible matching ideas, des idées pour le jumelage entre les parents ou les pères. The consultation lasted 64 days, and we saw over 2,300 visits to the website with contributions from 56 registered individuals. We had, for the most part, our participants were female, and we saw different cultures represented, and about 83% of the survey respondents already had children. For more information on our what we got through the Engage Ottawa, Participant Ottawa, visit www.parentingottawa.ca/peer parenting support. Pour plus d'informations, visitez êtreparent@ottawa.ca/entre parents avec un S. So here's the idea that we've kind of put together. So we're looking to create a list or a database, if you will, of different peers, different types, and it's really open. This is not a finished product by any means. This is just kind of a concept that we've put together, and there's some suggested themes, if you will, for individuals searching for a peer. So they could, for example, enter a topic. They could put in their neighborhood to find services within their neighborhood. Maybe it's a service provider, as there's programs out there that already have peer mentoring programs, and it's a matter of connecting them, so it gives one place for parents to go when they're looking to connect with others, and as well as their language. If you want to click, it should animate, just to give you a little bit of an idea. And once people select some of these boxes, it should generate a list of different volunteers. So you'll see an example. I threw myself up with my kids as an example. And this is the French side. So on pourrait choisir différents thèmes pour le monde de choisir, pour pouvoir choisir, trouver un aidant pour pouvoir demander leurs questions. Ça, c'est l'idée que nous avons formée pour ce projet. So, what do you think? Do you like this idea? Maybe not. This is your opportunity to thumbs up or thumbs down the idea. Sondage rapide, aimes-tu cette idée? So for the most part, people seem to like this idea. So at first glance, what do you think? So what came to mind with this idea? So this is your opportunity to kind of type a quick thought, idea, comment. À première vue, que pensez-vous de cette idée? J'adore l'idée et le concept, un projet dont nous avions commencé à discuter localement. Easy to navigate, so much focus on cannabis use, more time, other issues, easy to access, my choice. I think it's a good, easy resource for parents looking for supports. It seems user-friendly. Great idea. Sounds like a great concept. Will be interesting to see how it works in practice. I agree with that. Love the pictures on the mentors. I'd like to see a tab for mental health. Perfect. Straightforward, easy. How can we connect to this to the PRC Go Family app? Easy accessible. Having more options is always better. I agree with that as well. Wondering about privacy, that's an excellent question, and I've started having those conversations with our privacy officer and our legal team as well. So one of the assumptions with this type of tool is only first names would be used on the website, so we wouldn't put last names, there wouldn't be email contact. The idea being that to contact the mentor, you would click a button that would send in the background your message to the mentor. So we would never put forward-facing information on a website. I love the pictures. Having more options is always better. Okay, thank you. So here are some possibilities. Voici des possibilités. So you're going to use your Mentimeter app to kind of say whether you agree that this is a good possibility or disagree. So the ability to choose your own topic or area of concern, la capacité de choisir son propre sujet ou domaine de préoccupation, get individualized and personal support, obtenez un soutien personnalisé, mentors with diverse experiences, aidant au vécu divers, open to mentor from various organizations, ouverte aux aidants de diverses organisations, linking your current mentors to this opportunity, établissement de liens entre vos aidants et cette possibilité, promotion and awareness of local resources, promotion des ressources locales et sensibilisation, support from OPH, so that would be our Healthy Babies, Healthy Children program, 613 Parents, or Parenting in Ottawa Services, soutien de Santé publique Ottawa, and support from your or other community organizations, du soutien des autres agents communautaires ou votre organisation. Looks like the big winner is the promotion and awareness for other local resources. Okay. The other question I wanted to ask, la prochaine question, is whether we should have the option of a profile picture or no option at all. So that should load in a second, and on your Mentimeter app you'll see whether you think, and it doesn't, even though we have the option, doesn't mean you have to put a profile picture up, but your thoughts on whether we could provide that option for a profile picture when you're looking for that peer. L'option d'avoir un photo de profil en choisissant l'aidant à qui demandez vos questions. Is it frozen? Oh. It should be logged in. No, go to Chrome. I'll give it a second to load. It might take a little while. Looks like we've had one response, so. Okay. So the second concept or part of this project that we were thinking of is a peer mentor portal. So un portail pour les aidants, a place where the peers can go to connect, to access information. So in 2005, when we started Ottawa Breastfeeding Buddies, we had a binder, and it had a whole bunch of information in it. As soon as you print that information, it becomes obsolete. So we were thinking, how can we fix or improve that practice? So we were thinking, we proposed the idea of creating a peer mentor portal. So this would, the assumption here would be it's a closed group for mentors to be able to access, to connect, to access that information. It's a way to communicate even with each other, so they can have support with each other as well. It's a knowledge exchange, and there would be support from Ottawa Public Health. So l'idée du portail des parents, c'est un système privé et fermé uniquement pour les aidants, animé par Santé publique Ottawa. So again, do you like this idea? Sondage rapide, aimes-tu cette idée? And even thinking we could have, if there's other programs that join this program that have peer mentors, we can provide access as well, so that that knowledge exchange and even resources that exist in the community could be promoted there as well. And that'll be part of the roundtable discussion, or please feel free to come and have that conversation with me as well. Absolutely, I would love that feedback. So, at first glance, what do you think? Or maybe you can provide some of that feedback here. À première vue, que pensez-vous? Sounds great, looks good. It kind of feels like a dating site, but not necessarily a bad thing. I would agree with that, and I've had that comment a few times. It's a good idea. If not technically savvy, educated person, hard to navigate. And that's good feedback, so we'll have to make sure that we find ways to make it as user-friendly as possible. Innovative way to allow multiple organizations, people to post their resources, like the peer portal. Needs to link to existing portals, like the idea. Continued training for mentors will increase validity. That's the other thing with the peer portal. We have the capacity to even upload videos, so we could potentially put training videos to share amongst organizations, or even share what different organizations do across our city. I like the idea of a portal where there is up-to-date, easily accessible information for all parents. I'm curious to know the topics that will be available, and that'll be part of our conversation, our roundtable. Great way to keep everyone in check with one another. Support systems for the ones facilitating is very important. New ideas are great. Is there a mobile app available which can be easily accessed by parents? Could be quite helpful. We'll need a cool promo. That'll be part of the roundtable discussion as well. Like having peer support in a variety of formats. One of them is online. Certainement un bon projet qui pourrait être répliqué ailleurs pour d'autres régions, spécialement en situation rurale, comme ici dans Prescott-Russell, où la distance a un grand impact sur l'accès aux gens qui... Oh, I missed the... It went a little too fast. Perfect, thank you. So another question for our partners, what roles can organizations with mentors play in this program? Quel rôle les organisations avec des aidants peuvent-elles jouer dans ce programme? This might take a little bit of time to think about. It's kind of a big question. That's a big question, yeah. That's fair. Mentors would be those who would be providing support to other parents, provide program information training, education and training, meeting space, evaluation, expand the diversity of mentors in the database, help keep the program current, recruit mentors, screen and train mentors. Fantastic. Thank you. So, any final thoughts or questions? And if there aren't any, that's okay. I'm happy to take questions or comments throughout the break. It just means you get to break a little earlier. Have you considered group-based peer support? We did. Actually, when we started looking at this program, I was looking at different tiers or levels, and group support was one of them, so we're absolutely open to it. It's just a matter of kind of exploring how we could do that and open to suggestions on how to host, to navigate, to provide that group support, because we know that is a benefit. When I did some of the literature search, a huge benefit for parents to be able to come together as a group. I think so. And then you click the arrow down. Oh, who screens, trains the mentors? Another excellent question. So in looking at it, if they were an OPH volunteer, or an aidant de santé publique, then we have a coordinator who would screen, who would train the mentors on behalf of Ottawa Public Health. But again, having those conversations with different community partners who have existing programs and already have those things set in place, it's just a matter of ensuring that it aligns and it's a good fit. And we can share resources that way as well. Part of the roundtable conversations will also look at what things do we want to make sure we have in place for screening, training mentors, things like a valid police record check, so some of those baseline things that we want to make sure everybody has as part of this program. Another really great question. So hopefully next year is when we'd see launching. Again, we're still in the development phase, still gathering that information, and as soon as I have a lot of the information today, we'll bring that all together and we'll work on the next steps. So interested and welcome anyone who wants to continue this conversation and engagement as we go forward and develop this program. Do you see peer support being mainly online or in person? So we also looked at different levels for that as well. I see it being in whatever shape, way, or form works for the individuals. So maybe online is how they find each other, and then it's a matter of deciding what works best for that peer mentor and that participant, whether they're meeting through phone, they're having a conversation online. The in-person place will definitely have to have the safety component looked into. For Ottawa Public Health, it might be meeting at a Parenting in Ottawa drop-in, where they would also have access to a nurse to answer other questions, or a lactation consultant if there was a breastfeeding question. So there's things to be looked at in that, but open to scoping that out. Has any conversation taken place about the time commitment from programs and or mentors? So I had a few conversations with another program in the US who runs a similar program, and it looks different. And it was interesting, one of the feedbacks I got was some of the mentors said they actually wanted more volunteers to reach out to them. Because this model is so open, it doesn't mean that the connection needs to be long-term. It might just be, I have a few questions and I want to connect with someone, or I want to connect with resources, and then that pairing closes. It might be longer term, so it'll be scoping that out, and it'll also be having that conversation with those peers to decide what they're comfortable with and what they're available to provide as well. So there'd be a flexible tier there as well, if you will. Is there funding? Good question. So we're working with what we have to build and explore and scope this program. that might be it. Perfect. There's more questions? What about chance of vicarious trauma when situations are too heavy for peer supporters? Will there be support for them? Absolutely. So that's where we want to make sure that Healthy Babies, Healthy Children, Ottawa Public Health is available. And part of that conversation at the Roundtable, we'll also be looking at what resources are available for those peers, because we know that sometimes having that conversation with someone can be extremely heavy for the peer mentor who's listening and receiving that information. So we do want to make sure that we have supports in place for the peer supporter as well. Okay. If there's any others or I missed any, please feel free to come in and see me. I want to thank you again and thank everyone online who participated. Merci à tous qui ont participé en ligne aujourd'hui. And that concludes the first part of our meeting. Thank you. Thank you. Merci à tous d'avoir participé aujourd'hui. On behalf of Ottawa Public Health, we really appreciate your ideas, feedback, participation, and time today. Everyone here or online today believes in the benefits of social support for parents. Et c'est pourquoi nous sommes ici aujourd'hui. This event was about connections and working together. Together we can create something that is meaningful to support parents and children and the community. As the saying goes, it takes a village to raise a child, and we have the opportunity to work together here. La discussion d'aujourd'hui est importante et nous avons besoin de la continuer pour créer un programme qui fonctionnera pour les parents qui en ont besoin. Following today's meeting, Ottawa Public Health will be reviewing all of the feedback as we move forward with building the peer parenting support program. For everyone who expressed interest in the peer parenting support program and Engage Ottawa participants, thank you for being a champion for other parents and your community. À toutes les personnes qui ont exprimé leur intérêt pour le programme de soutien entre parents et aux participants de Participants Ottawa, merci d'être un champion ou une championne pour les autres parents et notre communauté. Thank you to all our partners. Merci à tous nos partenaires. Your support and expertise are appreciated and invaluable. Merci. Thank you.